Good evening, medicos. Myself, Dr. Krishneshri, and our channel is back again. Today's session is about the evaluation of vertigo. So, in the last session, we have discussed about the vertigo in detail, its types, is it not? So, I think that you are happy with that session. So, today we will go directly to the evaluation of vertigo. So, first most important thing regarding evaluation is history taking. So, history taking plays an important thing in every disease and every symptoms. As far as vertigo is concerned, history taking is very important because the patients will be saying a generalized term. Harrison says that dizziness is the generalized term by which the patient expresses their symptoms or their feelings. So, they will not be saying vertigo. Sometimes they will be saying vertigo as dizziness. Sometimes they will be saying loss of stability as dizziness. Sometimes they will be saying lightheadedness as dizziness. They will be using the common term dizziness. Okay, so in dictionary also, if you are searching the term dizziness, the meaning is vertigo or talagarakam in Malayalam. But the thing is, according to Harrison, a physician should understand the difference between dizziness and vertigo. Then only we can correctly come to a conclusion and evaluate the particular vertigo. You understand? So, according to Harrison, dizziness is a broad term and dizziness includes three important conditions. So, these three important conditions forms the broad term dizziness. So, the first one is faintness or syncope. Second is vertigo and third is miscellaneous sensations of the head. So, first is first one in dizziness is faintness or syncope. So, syncope is a very important neurological symptom. We will be discussing syncope in the coming sessions. But for a better understanding of vertigo, for a better understanding of the differentiation of vertigo from syncope, I will say something regarding syncope. So, syncope, it is also known as faintness. And what is this syncope? What is the definition of syncope? So, syncope is a transient and sudden loss of consciousness. You understand? Transient and sudden loss of consciousness. Why this loss of consciousness happens? Because due to reduced blood supply to the brain, reduced cerebral perfusion or cerebral blood supply. So, this is the transient and sudden loss of consciousness due to reduced blood supply to the brain. So, in case of vertigo, there is no loss of consciousness. So, it is a perception, abnormal perception of movement. But here it is a loss of consciousness. And this loss of consciousness, some patient will be having pre-syncope, a condition known as pre-syncope. That is, the patient can feel that he is going to lose his consciousness. How? Suppose we will go to our school days. Okay, so we are standing in the sun in assembly, is it not? Morning assembly, we will be standing in the sun vertically for so many time. So, what happens? After prolonged standing, we will be feeling what? There will be blurring of vision, is it not? Most of the persons will be experiencing this. So, there will be blurring of vision, then there will be increased sweat, there is a feeling of lightheadedness, and also the person will be feeling that there is a heat sensation all over the body. So, these symptoms accounts for pre-syncope. So, suddenly what we will do if we are feeling all these symptoms when we are standing, what we will do? Suddenly we will sit. So, this is pre-syncope. Most of the patients with faintness will be experiencing pre-syncope before syncope. You understand? So, but in case of vertigo, there is no pre-syncope or there is no fainting. There will be only sensation of movement, abnormal sensation of movement. So, that is what? Syncope. Second is vertigo, and third condition which comes under dizziness is miscellaneous sensation in the head. So, this miscellaneous sensation in the head is not vertigo, it is not syncope. It is something in between that or something different from that but it is similar, but it is not that. Okay, so there are many conditions which leads to miscellaneous condition of head. So we will discuss some of the important conditions so that it is easy for us to differentiate. Okay, so the most important condition is hypotension, when there is slight reduction in BP. So what happens if we are having slight reduction in BP? We will be having some giddiness sensation, some lightheadedness, sometimes you will be feeling heaviness of head, is it not? But it is not vertigo, but it is not faintness, you understand. So that particular sensation which will not fit to this two category will be fitting to this miscellaneous conditions, miscellaneous sensation of head. So the first most important cause is reduced BP. Second is hypoglycemia. When there is reduced blood sugar level, a person will be feeling this particular sensation. Then third is when there is hyperventilation. So when there is hyperventilation, again some sensation of head will be there, which is not vertigo and which is not syncope. Then fourth is somatic symptoms of depression. So depressive persons will be having both mental symptoms and physical symptoms. So one of the physical symptoms in case of depression is this miscellaneous sensation of the head. So these are the most important 4 conditions that produces miscellaneous sensation of the head. So how we can trace all these things? Only through history taking. We should ask the patient about the remaining symptoms and about the sensation, what he is feeling when he is having that particular sensation. So history taking is very important as far as vertigo is concerned. You understand? Then only we can differentiate all these 3 conditions which comes under dizziness. Okay. So this is the first thing, history taking. Second thing is what? As usual, it is examination of the neurological system or central nervous system examination. So by a clear, definite and proper nervous system examination, what we can understand is we can come to a provisional diagnosis, almost to a provisional diagnosis of vertigo. So nervous system examination should be done in a what? Correct manner. Okay, starting from the mental state, ending to the system. Okay, so we should do it in a correcting. We will discuss this nervous system examination after completing the symptoms of neurology. Okay, then second thing is nervous system examination. Then third important test is provocation test. So this is the first time we are discussing about provocation test. So what is meant by provocation? You usually say, is it not? You don't provoke me, like that. So provocation test is creating an environment in front of the patient or to the patient as if he will be experiencing a sensation of vertigo or a sensation of dizziness or a sensation of miscellaneous head condition. So we will be provoking the patient to experience the sensation what he feels when there is a pathological thing. You understand? That's how we, by that we can differentiate the cause of vertigo. You understand? So provocation test. So first the provocation test is done for diagnosing cerebral ischemia, whether there is reduced blood supply, whether there is any condition which produces reduced blood supply which is leading to what? Vertigo. You understand? By this thing we can differentiate vertigo from what? We have explained is syncope. Syncope and vertigo can be differentiated from this. So the most important provocation. So there are so many provocation tests. We will discuss the important things only. So first is tilt table test. Tilt table test. It is also known as triple T, TTT test. TTT, triple table test. So this here what we will do is, there is a tilt table. There is a specialized table which is known as tilt table with so many safety belts. Okay. So here the patient is made to lie down in the tilt table, and what is the specialty of this tilt table is, this tilt table can be tilted so that the patient will be attaining a position that from lying to standing. You understand? So after making the patient to lie down in the tilt table, what the physician will do is, he will be tilting the table so that the patient will be made to a standing position from the lying position. So this table will be tilting like that. So as the tilting is as the physician is doing tilting, he also simultaneously will be monitoring the blood pressure in order to see whether there is orthostatic hypotension and to see whether this particular sensation arises due to orthostatic hypotension. You understand, whether there is fall in BP. So this is the tilt table test, which is a provocation test. So second provocation test. First we are discussing about the tilt table test. Now next is Valsalva maneuver. Valsalva maneuver. So what is this? So the physician asks the patient to close his nose, okay, by pinching the both nostrils and also close the mouth simultaneously. So the patient is asked to close the nose and also close the mouth simultaneously like this, okay, like this. Then the physician will ask the patient to exhale. So this is the thing what we will do when some mosquito or when some ants will go, when the ants go to our ear. So this is the thing we used to do. So because of this increased pressure, what happens? This ants or mosquitoes will come down. So what happens is when the patient exhales, there will be, what happens? The pressure in the thorax will be increased. So pressure in the thorax will be increased. As a result of that, more blood from the heart will be flowing towards the extremities, is it not? And as the pressure is increased and the patient is asked to maintain that particular posture for about 10 to 15 seconds. So what happens? Heart will be having less amount of blood. So in what the body will do, it will causes vasoconstriction, and as a result of that, there will be vasoconstriction, more amount of blood. So it is a big procedure, leave that. So here what happens is in Valsalva, when performing the Valsalva maneuver, what happens is there will be reduced BP and also the patient will be having symptoms of cerebral ischemia. If he is prone for that, he will be having symptoms of cerebral ischemia. So the patient will be feeling vertigo or the patient will be feeling faintness. You understand? Now we can differentiate faintness, syncope. By these procedures we can differentiate syncope from this vertigo. You understand? This is Valsalva maneuver. Then in order to see whether there is any vestibular dysfunction, there is a provocation test. So you should be very careful while doing this provocation test. Okay. So you should get the consent of the patient. You should explain to the patient before doing this test. So the patient is asked to sit in a swivel chair or rotating chair like this. So physician will be asking the patient to sit in a swivel chair or rotating chair. And suddenly what the physician will do? He will start rotating this chair. Okay. So very speedily he will be rotating this chair. And at a moment, he will be suddenly stopping the rotation. You understand? So physician will be rotating the chair where the patient is sitting very speedily, and at a point he will be stop rotating. So what happens? When there is vestibular dysfunction, surely the patient will get vertigo. You understand? Along with vertigo, the patient will also have nystagmus. Okay, so you should be very careful while doing this test, otherwise you will get cerebral ischemia from the hands of patients as well as the bystander. You understand, I think. Okay, so this is a procedure to note the vestibular dysfunction. Then there is another test in order to note the nystagmus. This test is known as Frenzel eyeglasses test. This is mentioned in our Harrison. Frenzel, F-R-E-N-Z-E-L, F-R-E-N-Z-E-L, Frenzel glass test. This Frenzel glass is a modified glass which is self-illuminating, and it consists of convex lens, self-illuminating convex lens. So after wearing this glass, the patient will be having blurred vision, but this glass magnifies the eyes of the patient so that the physician can see the eye of the patient in a magnified way. Understand? After wearing these glasses, what usually the physician will do is he will ask the patient to vigorously rotate the head vertically as well as horizontally. Okay, so first he will ask the patient to move the head vigorously in a vertical fashion. So what happens if there is vestibular dysfunction? There will be production of nystagmus, and also you can repeat the physician will repeat the test by moving horizontally. It is Frenzel eyeglass test. Okay, so these are the most important provocation tests which we will do in case of a vertigo. You understand? Okay, next. So 3 tests are over. First is history taking, 3 evaluation. First is history taking, second is proper neurological examination, and third is provocation test. Fourth, if we are suspecting some central cause for vertigo. If there is some central cause of vertigo, what we should do is, we should ask the patient to get MRI brain or MRI head, so that we can find some problem within the central structures which causes vertigo. Understand? If the provocation test is normal, or if from the neurological examination, if you are finding that there is some central pathology, then you can advise the patient for having MRI head, so that you can find out the pathology inside the brain. Okay. Then there is another test known as electronystagmography. So this is for vestibular dysfunction again, electronystagmography. So here what the physician will do is, in this test, alternately this cold water and hot water will be applied to the tympanic membrane. So what happens is, there will be change in the nystagmus which leads to the diagnosis of vestibular dysfunction. So this is electronystagmography. So these are the most important tests which we will do. Test is mostly this MRI brain, that is CT or MRI brain, and also electronystagmography. The most important thing is provocation test, then nervous system examination, and the very most important thing is history taking, as it differentiates vertigo from other symptoms or other conditions in dizziness. You understand? So this is the most important thing for evaluation of vertigo. So by this class, by this session, you have understood about the evaluation of vertigo in detail. In the previous session, we have discussed vertigo in detail. So I think you understood what I mean. So if there is any doubt, you please comment in the comment box. If you are happy with my session, please subscribe, please share to your friends. Happy learning, happy day. Next day we will be coming with another symptom of neurology. Thank you so much.